Welcome back. In today's video, we're covering Pediatric NCLEX Questions 2026 to help you prepare, practice, and pass with confidence. Let's get started. A nurse is teaching parents of a child with phenylketonuria, PKU. Which food should the parents avoid? Correct answer is B, whole milk. Rationale: PKU requires restriction of phenylalanine, which is found in high-protein foods such as milk. A 6-year-old child is diagnosed with nephrotic syndrome. Which assessment finding should the nurse expect? Correct answer is B, periorbital edema. Rationale: protein loss leads to decreased oncotic pressure, causing edema, especially around the eyes. A child with Down syndrome is at highest risk for which complication? Correct answer is B, congenital heart defects. Rationale: children with Down syndrome commonly have congenital cardiac anomalies such as atrioventricular septal defects. A nurse is caring for a child with Duchenne muscular dystrophy. Which finding indicates disease progression? Correct answer is B, positive Gowers sign. Rationale: Gowers sign reflects progressive proximal muscle weakness. A school-age child is hospitalized with rheumatic fever. Which history finding is most relevant? Correct answer is B, recent streptococcal throat infection. Rationale: rheumatic fever is a delayed complication of untreated group A streptococcal pharyngitis. A nurse is caring for a child with Kawasaki disease. Which finding is most concerning? Correct answer is D, development of a heart murmur. Rationale: Kawasaki disease can cause coronary artery aneurysms and myocarditis. New murmurs indicate possible cardiac involvement. Which finding suggests hypocalcemia in a child after thyroid surgery? Correct answer is B, tingling around the mouth. Rationale: perioral tingling and numbness are early signs of hypocalcemia. A nurse is caring for a child with hydrocephalus. Which assessment finding requires immediate reporting? Correct answer is C, sunset eyes. Rationale: downward deviation of the eyes is a classic sign of increased intracranial pressure. A nurse is caring for a child with neuroblastoma. Which finding is most characteristic? Correct answer is B, abdominal mass crossing midline. Rationale: neuroblastoma commonly presents as an abdominal mass that crosses the midline. A nurse is caring for a child with suspected intussusception. Which finding is most characteristic? Correct answer is C, current jelly stools. Rationale: intussusception causes telescoping of the bowel, leading to bloody mucus stools described as current jelly. Which assessment finding is expected in a child with acute otitis media? Correct answer is C, bulging, erythematous tympanic membrane. Rationale: middle ear infection causes inflammation and bulging of the tympanic membrane. Which assessment finding best differentiates viral from bacterial pharyngitis in a child? Correct answer is C, exudative tonsils with petechiae. Rationale: streptococcal, bacterial, pharyngitis often presents with tonsillar exudates and palatal petechiae. A 3-year-old child is admitted with suspected epiglottitis. Which nursing action is the highest priority? Correct answer is B. Prepare for possible intubation. Rationale: epiglottitis can rapidly cause airway obstruction. Maintaining a patent airway is the top priority. Which intervention is most appropriate for a child with severe croup? Correct answer is C. Nebulized racemic epinephrine. Rationale: racemic epinephrine rapidly reduces airway edema in severe croup. A nurse is caring for a child with acute respiratory distress syndrome, ARDS. Which finding indicates worsening condition? Correct answer is C. Increased PaSSO2. Rationale: rising carbon dioxide levels indicate inadequate ventilation. A nurse is caring for a child with acute liver failure. Which laboratory value is the nurse most concerned about? Correct answer is B. Increased ammonia level. Rationale: elevated ammonia can cross the blood-brain barrier and cause hepatic encephalopathy. A nurse is caring for a child with tetralogy of Fallot who suddenly becomes cyanotic and dyspneic. Which intervention should the nurse perform first? Correct answer is B. Place the child in a knee chest position. Rationale: the knee chest position increases systemic vascular resistance and improves oxygenation during a TET spell. A nurse is caring for a child with osteomyelitis. Which laboratory finding is expected? Correct answer is B. Increased white blood cell count. Rationale: osteomyelitis is a bone infection and causes elevated inflammatory markers. Which finding is most concerning in an infant with acute dehydration? Correct answer is C. Capillary refill of 4 seconds. Rationale: prolonged capillary refill indicates poor perfusion and possible hypovolemic shock. Which laboratory finding is expected in a child with iron deficiency anemia? Correct answer is B. Decreased hematocrit. Rationale: iron deficiency leads to decreased hemoglobin and hematocrit levels. A toddler with lead poisoning is most likely to exhibit which symptom? Correct answer is B. Abdominal pain. Rationale: lead poisoning commonly presents with abdominal pain and constipation. A child with croup is admitted to the pediatric unit. Which assessment finding indicates improvement? Correct answer is B. Decreased stridor at rest. Rationale: reduced stridor at rest indicates improvement in airway obstruction. The nurse is teaching parents about sudden infant death syndrome, SIDS, prevention. Which statement indicates understanding? Correct answer is C. My baby will sleep on the back. Rationale: supine positioning significantly reduces the risk of SIDS. Which finding is expected in a child with hyperthyroidism? Correct answer is C. Tachycardia. Rationale: increased metabolic rate causes tachycardia. A nurse is caring for an infant with bronchiolitis. Which assessment finding requires immediate intervention? Correct answer is C. Oxygen saturation of 88%. Rationale: hypoxemia requires immediate oxygen support. A child with acute asthma exacerbation is receiving albuterol. Which finding indicates the medication is effective? Correct answer is B. Decreased wheezing. Rationale: reduced wheezing indicates improved airway patency. A child with spina bifida, myelomeningocele, is scheduled for surgical repair. Which preoperative nursing action is most important? Correct answer is B. Maintain the child in a prone position. Rationale: prone positioning prevents rupture and infection of the exposed spinal sac. Which intervention is most appropriate for a child experiencing a febrile seizure? Correct answer is C. Place the child on their side. Rationale: side positioning prevents aspiration during seizures. Which finding suggests child abuse rather than accidental injury? Correct answer is B. Spiral fracture of the humerus. Rationale: spiral fractures are often caused by twisting and are suspicious for non-accidental trauma. A nurse is caring for a child with cystic fibrosis. Which intervention is most important before meals? Correct answer is C. Give pancreatic enzymes. Rationale: enzymes must be given with meals to aid digestion and nutrient absorption. Which vaccine is contraindicated in a child who is immunocompromised? Correct answer is C. MMR. Rationale: live vaccines such as MMR are contraindicated in immunocompromised children. The nurse is caring for a child with acute glomerulonephritis. Which order should the nurse question? Correct answer is C. High-protein diet. Rationale: protein intake may need to be limited to reduce kidney workload. Which toy is safest for a 6-month-old infant? Correct answer is B. Soft stuffed toy. Rationale: infants explore by mouthing objects. Toys must be large, soft, and free of choking hazards. A nurse is caring for a child with diabetic ketoacidosis, DKA. Which finding requires immediate action? Correct answer is D. Decreasing potassium level. Rationale: insulin therapy drives potassium into cells, increasing the risk of life-threatening hypokalemia. Which finding is characteristic of meconium aspiration syndrome? Correct answer is B. Grunting and retractions. Rationale: respiratory distress is common due to airway obstruction. A nurse is preparing to discharge a child with type 1 diabetes. Which statement by the parents indicates further teaching is needed? Correct answer is C. We can stop insulin during illness. Rationale: insulin should never be stopped during illness, requirements may actually increase. Which assessment finding suggests increased intracranial pressure in a school-age child? Correct answer is C. Projectile vomiting without nausea. Rationale: sudden vomiting without nausea is a classic sign of increased ICP. A nurse is caring for a child with status asthmaticus. Which medication should the nurse anticipate administering first? Correct answer is C. Short-acting beta-agonist. Rationale: rapid bronchodilation with short-acting beta-agonists is the first-line treatment. Break time equals 1. 5s/. A nurse is evaluating pain in a nonverbal infant. Which indicator is most reliable? Correct answer is C. Facial expression. Rationale: facial expressions are the most consistent and validated indicators of pain in infants. A nurse is teaching parents about post-tonsillectomy care. Which instruction is most important? Correct answer is C. Report frequent swallowing. Rationale: frequent swallowing may indicate bleeding, a serious postoperative complication. A child with congenital diaphragmatic hernia is admitted to the NICU. Which action is contraindicated? Correct answer is C. Bag mask ventilation. Rationale: bag mask ventilation increases air in the stomach, worsening lung compression. A nurse is caring for a child with acute lymphoblastic leukemia, ALL. Which assessment finding requires immediate reporting? Correct answer is D. Fever. Rationale: fever may indicate infection in an immunocompromised child and is a medical emergency. Which psychosocial intervention is most appropriate for a school-age child undergoing chemotherapy? Correct answer is B. Encourage peer interaction. Rationale: school-age children value peer relationships and benefit from social support. A nurse is caring for an infant with necrotizing enterocolitis, NEC. Which finding is most alarming? Correct answer is C. Bloody stools. Rationale: bloody stools indicate bowel necrosis and possible perforation. A child with hypothyroidism is started on levothyroxine. Which finding indicates effective treatment? Correct answer is B. Increased energy. Rationale: improved energy and activity reflect normalization of metabolism. A child with severe traumatic brain injury develops bradycardia, hypertension, and irregular respirations. This finding indicates. Correct answer is B. Increased intracranial pressure. Rationale: this is Cushing's triad, a late and dangerous sign of increased ICP. A toddler is admitted with acute salicylate, aspirin, toxicity. Which acid-O-base imbalance does the nurse anticipate? Correct answer is C. Mixed respiratory alkalosis and metabolic acidosis. Rationale: salicylates stimulate respiration and later cause metabolic acidosis. A nurse is caring for a neonate with persistent pulmonary hypertension of the newborn, PPHN. Which intervention is most critical? Correct answer is B. Maintain high oxygen concentration. Rationale: oxygen acts as a pulmonary vasodilator, reducing pulmonary vascular resistance. Which finding in a child with Haynock-Schönlein purpura, HSP, requires immediate attention? Correct answer is C. Abdominal pain. Rationale: severe abdominal pain may indicate bowel ischemia or intussusception. A nurse is evaluating a child with suspected child neglect. Which finding is most suggestive? Correct answer is C. Poor hygiene and untreated medical conditions. Rationale: neglect is characterized by failure to meet basic physical and medical needs. A child with severe burns is in the acute phase. Which urine output indicates adequate resuscitation? Correct answer is B. 0.5 to 1 ml/kg/hr. Rationale: this urine output reflects adequate renal perfusion in pediatric burn patients. A nurse is caring for an infant with pyloric stenosis. Which acid-base imbalance is expected? Correct answer is C. Metabolic alkalosis. Rationale: persistent vomiting causes loss of gastric acid. Which intervention best prevents central line-associated bloodstream infections, CLABSI, in children? Correct answer is B. Strict hand hygiene. Rationale: hand hygiene is the most effective infection prevention measure. A nurse is caring for a child with Guillain-Barré syndrome. Which assessment finding requires immediate reporting? Correct answer is D. Shallow respirations. Rationale: respiratory muscle involvement can lead to respiratory failure. A nurse is caring for a child with aplastic anemia. Which finding is most concerning? Correct answer is C. Recurrent infections. Rationale: bone marrow failure causes severe neutropenia and infection risk. A nurse is assessing pain in a school-age child. Which tool is most appropriate? Correct answer is C. Numeric pain scale. Rationale: school-age children can self-report pain reliably. Which finding indicates improper insulin administration in a child with diabetes? Correct answer is A. Lipohypertrophy at injection sites. Rationale: failure to rotate injection sites causes fatty tissue buildup and poor absorption.